100 Days in Care. A Run of Bad Luck. Balabhadra's visit. Sign of the times. Serving Shambhu. Treating skin fungus. March 2007. 100 Days in Care. Kala Krishna's wound on arrival, November 22, 2006. An injection is administered in between the exposed bones 3 months after his arrival at CFC. Kala Krishna is out of intensive care, his bones have mended, his wound has healed, and massage and physiotherapy sessions are now part of his daily program toward recovery. Hit by a car which fractured both his back legs in November last year, Kala Krishna lay on the roadside for 3 weeks before CFC was alerted and he was brought in. As reported in the CFC December news, Kala Krishna's right back leg had an open infected wound, deep down to the bone, where a piece of bone was missing, and more fragments migrated out over the course of his wound care treatment. Above the wound another fracture was found in the stifle, and on the left back leg, his leg was fractured at the hip. X-rays at Mathura Veterinary University confirmed the 3 fractures and doctors advised a poor prognosis for a full recovery. It was hoped that in time the right back leg would become the strong leg, as it was suspected use of the left back leg would be minimal. Casts could not be set on either of the limbs due to the awkward locations of 2 of the fractures and the large open wound at the third. As immobilization was not probable, it was advised to keep the calf separated from peers, calm, and strive for the least amount of movement to the back legs, in hope that in time the bones would mend. Kala Krishna's light weight was a contributing factor to reducing the risk of pressure sores as he lay recumbent over the first months. Initially Kala Krishna would change sitting positions on his own, swinging his front legs over to the right to rest his weight on the right side, then back again in a few hours over to the left. Within a few weeks though, Kala Krishna was uncomfortable sitting on the right side and could manage only short periods lying flat on the right, so most of the time was spent with his weight on the left. This in turn helped immobilize the left leg against the hip, and after 6 weeks it was found that the fracture was fused in place, something totally unexpected and nothing short of a miracle according to Dr. Lavanya, who was elated to see the innocent calf's amazing progress. Kala Krishna's wound though was not progressing so well and many setbacks were presented over a 3-month period. The first month showed wonderful signs of healing, at least on the surface, as it was then discovered a pocket of infection was festering and increasing in size below. Kala Krishna takes a ride to Mathura Veterinary University for X-rays and a checkup. Dr. R.P. Pandey takes a series of X-rays on both back legs. The wound had healed well over the first month until a pocket of infection was found. Dr. Lavanya makes an opening to access the underlying abscess. 2 more incisions are made on the backside of the leg so the infection can be drained quickly. The new tissue, and it was difficult to clear as it was deep-rooted, based where the pieces of bone had come out. The underside of that same leg, behind the wound, was swollen, hot and very painful when touched. It was filled with pus and Dr. Lavanya squeezed some of the discharge through the top of the wound where there was a small opening, then enlarged the opening, cutting 1/2 inch with a scalpel. He widened the inside channel down to the bone to enable the infectious discharge be released and cleaned regularly. The doctor then made a small cut in the underside of the leg so the discharge could be easily flushed out and drained from one side through to the other. Another small incision was then necessary toward the front as an isolated pocket of infection was found and needed to be released. Adding to the first initial big wound that was healing well, Kala Krishna now had a total of 4 drainage points and his leg was very sore indeed. On and off throughout Kala Krishna's wound care, anti-inflammatory and antibiotic injections were given under the doctor's instructions. Side by side the allopathic drugs, he was on both homeopathic remedies and various Ayurvedic medicines. Necrotic tissue is removed from within the abscess cavity once his daily wound cleaning is complete. Kala Krishna relaxes in the winter morning sunshine. The wound continues to heal. Photo taken 2 months after his arrival. Wound dressings such as packed iodine gauze, sugar, antibiotic powders, antiseptic creams and others were applied according to the changes taking place in the wounds. Daily wound cleaning continued over the 3 months, with wounds being cleaned twice daily when the quantity of discharge was high. Another alarming setback during Kala Krishna's recovery was fluid in the respiratory tract, possibly a result of cold and being down for a long time, which affected him twice but was successfully eradicated both times with a short course of antibiotics. and a lot of rest under the healing Vrindavan winter sunshine. Meantime the bottom two wound incisions closed and healed, only to reopen with more infection soon after. But in time the wound fully healed, finally, and Kala Krishna was bandage-free after a 3-month ordeal. All his carers and admirers rejoiced and Kala Krishna was relieved to be off the morning medical rounds list. Another plus for Kala Krishna is he maintains a voracious appetite and has good digestion. The next challenge facing Kala Krishna is frozen joints, a result of both of Kala Krishna's back legs being immobilized for a long period of time. It affects both back legs. By mid-January Kala Krishna's 3 fractures had mended and physiotherapy was underway as the wounded area was painful. Physiotherapy could not be performed on the right leg while Kala Krishna is fast asleep. His magnetic boots are at work, rotated from front to back legs daily 4 places in the right leg, and 1 place in the left. The left leg is straight and does not bend, the right is the opposite, it is bent up and does not straighten, so he cannot use either leg to stand at this stage. Now that his wound has healed and the pain has disappeared, light massage and physiotherapy has commenced on the right leg, which is 6 weeks behind the left one. Slow but sure progress is being seen on the left leg and we pray that in time it increases. A God-sent companion for Kala Krishna has recently arrived at CFC, in Little Kamili from Radha Kund, who featured in last month's CFC February news. Kamili does not have use of either of her back legs due to a possible birth defect, and as she shares Kala Krishna's pen, he learns techniques from watching her how to manage with his similar disability. Since her arrival he has so much more confidence and inspiration to improve, he has once again started to change sides unassisted, is sharing time up in Kamili's sling, and today he began an attempt to walk using his front legs, with his back section raised by a carer, as is done with Kamili. She is able to communicate with him where we mere humans fail to do so. We heartily welcome Kamili to our team of Kala Krishna's carers. Inspired by Kamili insert photo Kala Krishna increases his sessions in the calf sling. Balabhadra's visit. Prem Sagar looks on as Balabhadra Dasa surveys Belvan ISKCON's Minister of Cow Protection. Balabhadra Dasa, USA, recently spent several days visiting Goshalas in Vrindavan including the Bhaktivedanta Swami Goshala, Go God, Care for Cows, Sundrak and Belvan, Surabhai Goshala, Radha Kund, and Govind Godhama, Akrura God. He was especially impressed with the dedicated medical care performed by Syam Gauri Dasi at Care for Cows and was happy to see the health of her patients improving. He mentioned that he was impressed with the great responsibility Sudivai Dasa has taken in serving injured cows in Radha Kund. Balabhadra Prabhu was happy to visit Belvan and experience the peaceful atmosphere there. He was concerned that flooding may affect the area since the Yamuna River is only about 300 meters away. He asked a local villager if the Yamuna had ever flooded this area and was told that she never comes here out of respect for the forest where Lakshmi Devi performed austerities for obtaining the benediction to observe the Rasa Lila of Sri Krishna. When asked how Care for Cows could improve their service, Balabhadra Prabhu responded that we should also take responsibility to inspire and train others to preserve the tradition of serving cows strictly for the sake of pleasing Lord Krishna. Left, Balabhadra Prabhu with Sudivai and Kurmarupa during a program held at Govind Godhama between Vrindavan and Mathura. Below, a wayward goose waddled over from the Yamuna River to Belvan and decided to bathe in the cow's water trough. Balabhadra happily accommodates the welcomed guest. A run of bad luck. Devaki recuperating from surgery, the sutured wound covered with a skirt to protect it from flies and crows. Devaki's medical history was relayed to Sudivai of Surabhai Goshala in Radha Kund. As such, Devaki had what appeared to be a vaginal prolapse, a lump of decaying, maggot-infested tissue was protruded below her tail and persons who knew no better pushed it all back inside. Her back left leg was shorter than the right and hung 6 inches off the ground, atrophied from a previous fracture. She found it difficult to stand up on her own and a white fluid constantly oozed out from her birth canal, creating an unbearable stench that attracted flies. In this sorry condition Devaki was taken into Sudivai's care and as her appetite waned, her weight decreased and her morale dropped. Dr. Lavanya examined Devaki last month at Radha Kund and delivered the shocking news that the cause of the white odorous discharge was a dead fetus retained in her womb. The uterus mouth was closed and it was not possible to manually remove the fetus. Advising that removal of the dead calf was imperative for Devaki's survival, immediate arrangements were made for Devaki to be taken to the Mathura Veterinary Hospital. After spending the time, money, and trauma to transport Devaki to hospital, it was found that only skeleton junior staff were on shift that day as the main doctors were attending a conference, and Devaki's serious condition could not be preparing Devaki for surgery by shaving the hair from part of her left side. Dr. G.D. Singh douches Devaki's uterus with diluted iodine through a tube attended by them. Devaki returned home. Dr. Lavanya made separate arrangements for a retired specialist gynecologist from Mathura to treat Devaki, and requested she be transferred to CFC so Dr. Lavanya could prepare her for the upcoming procedure. Sudebai immediately arranged for Devaki to be brought into CFC, and over a number of days Dr. Lavanya administered a series of medications in an attempt to dilate the uterus mouth, to gain access to the contents. However, it was found that the dilation was very less, and in Dr. Lavanya's attempt to remove the dead calf, he came across small pieces of bone, all clean of tissue, which indicated the calf had died possibly 12 months ago. Dr. Lavanya's friend and colleague, Dr. G.D. Singh, MVSc PhD Gynecology, retired professor from the Department of Gynecology at the Mathura Veterinary University, arrived February 21 to give Devaki a checkup and decide with Dr. Lavanya how to best proceed with her case. Devaki's side was shaved in advance that morning, and she had fasted from breakfast, ready for surgery should it be an option. After the initial examination, Dr. Singh proceeded to thoroughly irrigate the uterus with diluted iodine through a douche tube, which washed some quantity of discharge out, and Dr. Lavanya inspects the calf bones being manually removed from the uterus by Dr. Singh. Some skeletal remains of Devaki's unborn calf. Devaki's surgery unable to remove the uterus contents. The doctors close 4 days after the operation. Devaki's side wound is healing well with no complications, enabled him to remove some small bones. The doctor then inserted a long wire hook to catch hold of other bones, and though he was able to remove more in this manner, he said that many were stuck tight into the thick uterus lining and it was risky to pull them in case they ruptured the wall, creating windows for infection to spread inside. With surgery as the only remaining option, no time was delayed in preparing for the surgery on site at CFC. An epidural anesthetic was administered, another local injected at the site, and Dr. Lavanya proceeded the operation, opening from the left side, at the best side to access the uterus. All were in anticipation that Devaki's problem would soon be solved, having endured months of suffering due to neglect, being sore from the invasive procedures endured recently, and now an operation. But Devaki's was not a textbook case, and the doctors came across another hurdle. The fetal remains, including the skull, were fixed to the right side of the uterus and could not be removed without the risk of rupturing the tissue. The doctors decided to close. Once Devaki has fully healed from this surgery, the doctors will make another attempt, this time opening from the right side. She is scheduled for the next surgery early March. Mangala's joy. Sneha welcomes Mangala's son into the herd. 10 months ago, while the herd was walking up to the hill to sit for the day, a stray black bull approached Mangala and within 15 seconds impregnated her. This month she gave birth to her second calf, this time a healthy chocolate-colored bull. He was born at 6 a.m. and began to walk within an hour. Sign of the times. Rohini, after her surgery to try and save her hoof, Kali Yuga, the present age of hypocrisy and quarrel, was ushered in by Kali mercilessly beating a cow and bull. When Maharaj Pariksit came on the scene, 3 of the bull's legs were broken and Kali was attempting to break the bull's 4th leg. A sure sign of the times is the rule and actions performed by government heads and citizens in general. As millions of cows and bulls are slaughtered throughout the world, though an abominable unjust act, it is considered by most persons living in those countries as normal and socially acceptable. As such, Kali continues his rampage on the earth, and has reached even the holiest of all holy places, Sri Radha Kund. Rohini, An abandoned cow left to fend for herself wandered into a farmer's unfenced field and helped herself to a share of the crop. Though the ancient Vedic scriptures sing the praises of protecting and offering food to cows as an act of charity, out of fury the farmer beat the cow and drove a shovel through her front leg, which severed the bone and half her hoof off with a clean diagonal cut. This happened last month and word reached Sudevi from Surabhi Goshala at Radhakund, who arranged to find and bring the suffering and injured cow in for urgent treatment. Dr. Lavanya was called to examine the injury, and though he advised amputation, Sudevi pleaded he try to first save the hoof, as she has other amputee cows who have a lot of difficulty managing on 3 legs. The doctor said he would try his best, and Rohini was given an anesthetic. Rohini's mutilated leg, the result of a farmer's rage. Dr. Lavanya administers anesthetic before beginning the procedure, removing tissue from the bone before cutting off the sharp bone, and injection intravenously to have effect through to deep tissue. Once the anesthetic took effect, Dr. Lavanya cleaned out dead tissue surrounding the bone and from within the contaminated wound. He then detached tissue from the broken protruding bone and removed the sharp bone an inch above the infected area. Small sharp pieces of bone in the below section of the leg were clipped back to a straight edge using a bone cutter. Rohini's hoof was hanging on by a strip of tissue and skin down one side where the bone was missing, and there was not much to suture together around the large open cavity. Dr. Lavanya sutured what area he could and treated the rest as an open wound. Once complete, the leg was bandaged and a simple but effective splint was secured around the limb to support her weight on the leg. After given something for pain, the cow then stood up and eagerly limped off for her evening meal of fresh green grass. It was hoped that the wound would heal, tissue fibrosis would take place, and eventually, after a year or two, the site may calcify and form a false joint. However, 2 weeks after the procedure, Rohini's hoof became infected and Sudevi had no choice but to have it amputated. Dr. Lavanya clips off sharp pieces of bone with a bone cutter. Life in the streets while competing for stale chapatis in the garbage dump. A dog tore my left ear. It hurt, but I was so hungry I could not help but return. The second time he took almost half of my right ear. We are not meant to compete with them. Give us shelter care for cows. INVRINDAVAN. Did you know? Suradasi's bull calf was born with a handlebar mustache. Padmagandha can be seen daily at Care for Cows sporting his unique mustache. Lumpy skin fungus iodine liquid is gently patted onto the affected area with cotton wool. Ringworm on Gopi's eyelids, face, and many parts of her body. Upon her arrival at CFC after 6 weeks of treatment, Gopi's skin problem is overcome, but scar marks are seen in the hair growth. In time, new hair grows and replaces the old coat, and the marks disappear. Gopi's beauty is restored. Fungal infections, in this case ringworm, commonly affects calves, creating lesions particularly over the head and neck, but may occur on any part of the body. Circular areas of thickened and often encrusted skin develop at a later stage. Ringworm causes irritation, and if affected calves rub against posts or feed troughs, they deposit spores that can remain infective for up to 4 years. Spontaneous recovery is commonly seen, with untreated fungus running its course and disappearing in time. At CFC, many abandoned calves and cows are brought in with later stage lumpy skin fungus. Our cases are treated firstly by removal of easily lifted crusted material that does not cause bleeding to the underlying skin, and then full area wash with iodine liquid solution. Severe cases are healed within 4 to 6 weeks, with the area being treated reduced dramatically with daily application. If caught early, ringworm can be treated with the same iodine wash, which checks further progress of the fungus and clears up within 7 to 10 days. Separate lodging for infected calves or cows is strongly recommended while undergoing initial stage treatment, to reduce the risk of transfer. Serving Sambhu. 10 straight days of out-of-season rain in early February brought with it a deluge of issues for caring for our sick cows. Most affected was our recent admission, the old street bull Sambhu. Sambhu suffers from a long-time dislocated hip, and over the winter months his movements were stifled. It was then he was brought into CFC and showed some signs of improvement after proper medical care and with the arrival of the warmer months of spring. The distance Sambhu could walk in a single day was little more than 100 meters, but it was a gradual and definite improvement. After the first days of rainfall, Samhu took a turn for the worst and was unable to stand without assistance. A huge endeavor was required to raise the heavy weight up from a sitting position onto his front legs, as 4 carers lifted his back legs and supported his weight from falling while other carers massaged his trembling legs. After 10 minutes of standing supported, Samhu could be released of the many hands, and was able to stand on his own for a couple of hours, but not walk. Then the rain fell all night long and Samhu was sitting on the wet ground, his body covered by an insulation tarp with a dry woolen blanket against his skin. By morning the area had become a puddle, and though Samhu's body was warm under the blanket, his underside was soaking wet. He was pulled to higher ground, out of the puddle, but the rain continued to fall and Samhu had to be moved. When the rain eased during the day, the carers loaded Samhu with great difficulty onto the flatbed bullock cart that was pulled by our strong working ox Bharat, and relocated Samhu under shelter in the outside sick bay area. With the continued rainfall and soaked ground, everything remained damp, and bedding especially was affected. Samhu was dried and kept now unable to stand. Samhu sits propped up as he rests on his soft mattresses. CFC carers swing Samhu over, the only way to change sides on an 800 kg patient. After changing sides, Samhu rests while Sushil tends to Samhu's initial pressure sore warm over the following days until at last the skies cleared. Now with Samhu down, the team of carers were aware of a lot of complications that could arise, setting Samhu's progress back further. Most serious to consider are pressure sores, collection of fluid in the lungs, bloat, and infection breaking open in the leg joints. In an attempt to keep Samhu comfortable, he is sat on a mattress of soft bags to help bear his weight, but inevitably a large pressure sore broke out on his right hip. His side is changed daily, but as he is unable to sit for long on the left side due to pain from his dislocated hip, Samhu can only spend an hour or so lying on that side to offer relief. Then he is at risk of bloating up with gas in the rumen, and so is changed back to the right side where he can sit up unsupported for most of the day. His legs and body are massaged daily, and he borrows Kala Krishna's magnetic boots to wear on his back legs. He is eating well. Samhu has shown signs on occasion of fluid in his lungs and respiratory tract, such as a loose gravel sound while breathing, fluid running from his nostrils, a lot of saliva accumulated in his mouth, and an infection smell. He is on his second course of antibiotics to try and fight the infection, and he is showing some positive signs of improvement. Extensive hair loss on the underside has occurred due to sitting in the wet those first few days of the rain. At present the skin is not broken in more than a few high-pressure areas that are being treated and are drying up. Today, 2 weeks after the rain, the ground is still muddy in places around the CFC Gosadan. In an effort to provide better care for our sick and weak residents, more emergency shelters and a larger area designated to the recovery ward have been planned. Construction commences in March. 2 weeks later, Samhu suffers from extensive hair loss. Cows are innocent and harmless, protect them. Dr. Lavanya cuts jagged bones back to a clean edge, though inches of bone are missing. Sudivai is trying to save Laxmi from amputation when most in need. Laxmi fractured and lost bone from her back leg in an accident and was taken to the Mathura Veterinary Hospital for treatment. When her owner was given the list of medicines to purchase, he not only fled the facility as quick as he could, but also his responsibility to maintain his cow any longer. He was never seen again, and Laxmi was accommodated in a room with Noon to supply her basics like food. The rotting tissue created an unbearable smell that filled the small room and alerted Sudivai, who was walking past the room on her visit to the hospital. She asked permission to take Laxmi back to her Goshala, where she would be fed well and given medical treatment by Dr. Lavanya. The staff agreed, and Laxmi is in Sudivai's care at Radha Kund. Sudivai's Gopa unwraps Laxmi's leg wound. Alessandra Petrassi, Italy. Anada Dasi, India. Ananda Subramanian, USA. Anonymous, Singapore. Bonnie Stewart, USA. Budhai Manta Dasa, NZ. David Kazanau, USA. David Thornton, USA. Dina Sarana Dasa, USA. Gopal Raja Dasa, India. Haripada Dasa, Spain. Hemant Ramana, USA. Induleka Dasi, France. Jivananda Dasa, SA. John Purdue, USA. Katyayani Dasi, USA. Radha Karan and Krishnamai, India. Labangalatika Dasi, India. Lisa Kubis, USA Mahabeu Dasa, USA Mahabir Dasa, Peru Mahabir Ya. Dasa, Canada Mariana Polinsky, USA Melanie MacDonald, USA Mukunda Dasa, UK Nalini Gagar, Netherlands Nalini Kanta Dasa, USA Nandaki Sor Dasa, SA Dr. Ortega Suarez, Colombia Padma Samhava Dasa, NZ Pranal Barath, SA Argori Ambal, USA Radha Jivan Dasa, USA Radha Mohan Savak, India Radha Patti Dasa, India Ramabhadra Dasa, India Shastra Dasa, USA Shraddha Patel, India Uttama Anya Dasa, India Vanamali Dasa, Poland Vananath Dasa, USA Varun Janeja, UK Vidyasagar Lakand, India Visvam Harapriya Dasi, USA Vyapaka Dasa. Canada Yojendra Sahu, India. The cows send their heartfelt thanks to those who assisted during February 2007.